Davis County Judge Executive Al Mattingly here. We're getting ready to do our weekly COVID update. And as always, I try to start the meeting with my mask on, even though I'm here in my office by myself, to encourage folks to take advantage of one of the few tools that we have that prevents the spread of the spread of the virus. I have with me today Dr. DuFrayne from Owensboro Health. Dr. DuFrayne, thank you for joining us. I would have to say that while the reason we're starting late is that while he's a very fine physician, he can't keep time worth a darn, and he had us down at 11:30. But anyway, we will not slow down. Today we have a lot of info to cover, and I want to make absolutely sure that you have an opportunity to send us a notice that I just had a phone call, by the way, too, so that those kinds of things happen. But I want to be sure that you have an opportunity to send us your questions. So as always, I'm going to start just kind of bringing you up to date on what goes on or what has been going on in Davis County. Today, I know back months ago, I would have never said this, but today we were fortunate in that our number of cases were smaller than what we had been averaging. We had somewhere around 74 cases in Davis County. Unfortunately, we had 2 additional deaths in Davis County. So if you would, just let's take a moment to remember those who won't be with us to celebrate the upcoming new year. Okay, I'm going to do a little something a little different today. In our 7-county grad region, that's Hancock, Ohio, McLean, Webster, Union, Henderson, and Davis, there have been 12,410 COVID cases. So that's confirmed COVID cases. The district-wide total of recovered cases is 9,364. So about 75% of those folks have recovered right now. 41 reported confirmed cases are currently hospitalized. 631 have required hospitalization. So about 5% of those who end up with COVID will end up in a hospital at some point. There have been 221 COVID-19 related deaths in the district, and the state of Kentucky is currently reporting 258,517 confirmed cases of COVID and 2,563 statewide deaths. The Green River Health is currently conducting flu shots and COVID-19 testing. You should get online, find their number. Either you can email or call them to make an appointment. But the Davis County Health Department is doing COVID-19 testing on January the 6th, the 13th, the 20th, and the 27th between 11 a.m. and 1:30 p.m. So between 11 and 1:30, call and set up an appointment. Flu shots, including high-dose vaccines for older folks like me and my wife, we always go in and tell them we want the old folks dose, can also be scheduled on their website or by calling your health department for an appointment. Just a little bit of trivia. The average age of a COVID patient, and this doesn't mean a lot, but the average age is 45 years. The age range, and this is what gets me as I looked at the data, is between 1 month to 102 years old. 45% of the cases are male, 55% are female. In Davis County, we have had 5,603, that's 5,603 confirmed COVID cases. 4,122 have recovered. And what's really to take away from that is you take the 4,122 away from the 5,603, and you've got somewhere around 1,300 active COVID cases. These have been confirmed by a test. 90 folks have passed away in Davis County. We've had 245 that were ever in the hospital. And as of yesterday, we had 28 who were currently in the hospital. And that's a real concern to me, because the sickest folks are the folks that go to the hospital. We've had 48 cases where the patient was less than 1 year old. Between 1 and 11 years old, we had 396. 12 to 19, we've had 1,003. So I see a lot of people saying that young people don't get it. Young people get it. Now, while they may not have as severe an infection as older folks, they transmit it just like everybody else. And that's why it's very important for families to be careful about being out in large groups and large crowds with young people in particular, or the young kids going to athletic practices and things like that, because they'll bring it home to mom and dad, who then go visit grandma and grandpa and older folks like me, and they'll transmit it to me. But here's where the big shift has occurred. 20 to 29, we've got 2,000 cases. 30 to 39, 1,900 cases. 40 to 49, 1,900 cases. If you look at the age groups, those three groups have been seen the biggest growth, because they're out in the community all the time. So one of the things that I wanted to do, and Dr. DuFrayne, I promise I'm going to get to you. One of the things that I wanted to get to was to show you some information regarding how how we rank, Davis County ranks compared to the other counties of the Commonwealth. So Jordan, would you put the first slide up there? This slide shows a positive test rate based on 100,000 cases. And you can see that we have a positive test rate of 16.1%, ranking Davis County 27th in the Commonwealth. Boyle County right now has a 20.7% rate. And as I look at the state's positivity rate, every day I go in and check. A lot of our border counties along the Tennessee border, those counties that border Illinois, are seeing large rates and increases in their infection rate. Let's look at the next one, Jordan. This is the infection rate. And you can see Bourbon County has an infection rate of 1.17. We're at 0.90. We're ranked 18th in an infection rate. Let's look at the next one. And this, yep, I've still got there you go, daily cases per 100,000. Right now we're averaging 58. Back on December 5th, we peaked at 95 cases per 100,000. So we made tremendous strides. I think folks are listening. Folks are wearing their masks. Folks are sanitizing their hands. Folks are social distancing, and folks are avoiding large crowds. I hope this continues after the Christmas. I'm sure that we're going to see probably a spike here in about 2 weeks after Christmas, and another spike after New Year's. But if there's one thing I can advise everybody, do what Judy and my son and I did. There were 3 of us for Christmas dinner. Usually we have 25 or 30. We're going to give up that 1 year to make sure that all those 25 or 30 are there with us next year. So with that, Dr. DuFrayne, I'm going to ask you to come on, and why don't you talk to us a little bit about what's going on at Owensboro Health, and then I'm going to get into some questions.
Okay, so thank you, Judge, and I do appreciate you taking your time, because it gave me time to catch my breath from running up the steps after Jordan. So I do appreciate it. So at Owensboro Health, right now we have 43 COVID patients admitted. And your numbers really match our numbers. About half of our admissions right now are from Davis County, and the other half are from outlying counties. And as I'm looking at the results right now, we're talking about maybe 12 other counties. So just a smattering here and there, but they tend to be the sicker patients. and they're sent up to the regional center, and that's the way it really should work. So we've been busy. It's been a busy December. It's been the busiest we've been. November and December have been the busiest we've been since COVID started. I think a lot of it is, it's, you know, winter, we're indoors more. There's fatigue of COVID fatigue. People are getting tired of isolation and wearing their mask and not going out. And like you said, Thanksgiving and Christmas, you know, with 2 or 3 people, and then that's it. So our admission rate has gone up. And right now at 43, we're about in the middle where we've been all month, somewhere between 40 and 50. So we started our vaccination program on Christmas Eve. We got the vaccines late on the night of the 23rd, and we were set and ready to go the morning of the 24th. So far, on average, we're immunizing about 350 people a day, and we've already passed our 1,000 mark. So it's actually going very well, pretty smooth process. On Thursday, I got my COVID vaccine. Only side effect I had was a sore arm. And I didn't even notice it till later that night. I was going to do something and put my arm up, and I'm like, oh, that's a little sore. Next morning I woke up, absolutely no symptoms. So I spoke with a few people, and they talked a little bit about, you know, aches and pains the day of the shot. The next day, they're up and at them and ready to go with no effect. So the vaccine program has actually been going really well. And we anticipate having all of our team members who want to receive the vaccine, we should have those done in about 2 more weeks. So that's kind of the state of affairs at.
Okay. Can you just, and I'm very interested in this with 40, I think you said 43.
43.
43. How does that compare with the capacity of the hospital to handle cases?
So for the most part, we're doing well. We've had a few days where we're at a surge capacity, meaning most of our beds are filled. And sometimes it's not just the beds, it's the number of nurses that we have to be able to work. And let's face it, they've been doing a fantastic job since March. And across the country, everybody's tired. So keeping that in mind, we're keeping the number of beds in mind. So we've been able to handle it really well. We've had a couple of days where it's gotten close. We're nowhere near what I'm reading that's going on in Los Angeles, where they're treating people in ambulances and outside tents. We're nowhere near that. So our capacity is actually doing well.
We, you know, early on in places like Boston and New York City, the higher density populations where they really got hit hard at the very beginning, they were doing those same kinds of things. And certainly that's what we tried to do here, was flatten that curve. In the end, the total number of people infected may not be any different, but what you're trying to do is prevent that huge rapid surge all of a sudden, which overwhelms the capacity of the hospital.
Right. Well, and that's absolutely correct. So even I'm looking at some of the numbers up at the hospital systems in Louisville, and they can be admitting 30 and 40 COVID positive patients a day.
Yeah.
So yesterday, I'm looking at the numbers. Yesterday, we admitted 9. So that's still a good number. And yes, going back to kind of reinforce what you were talking about, early on, what we really were seeing were the 65s and above, and they have really suffered the most. However, in our admissions yesterday, we had 2 people in their 30s, 1 in their low 60s, and the rest were late 60s to 92.
Okay. Well, and I'm seeing in the reports from those folks who pass away from this disease, I'm starting to see a lot more younger folks, young people actually being affected, which is kind of scary. I have one question that I'm going to get into real quick, and it's a question that I'm going to answer, and I'm going to ask you. Okay. It says, what are you doing to prevent the new strain from affecting us? And the answer is quite simple. I can't do a thing to keep you from getting the flu.
Right.
You need to be doing the things that we have been talking about doing for the last 9, 10 months, which again is wearing your mask, social distancing, sanitizing, avoiding large crowds. Those are the 4 tools that we have. We've just been given a wonderful Christmas gift in the COVID vaccines that are starting to be administered. But the simple truth is, I would doubt that there's going to be enough vaccine available to vaccinate everybody until the middle of next year, maybe. And again, we go back to the logistics. There may be the vaccine, but there just aren't enough healthcare workers and folks who are qualified to administer the vaccine to do it. So what are we doing? There's very little we can do except encourage you folks to follow all those protocols that you've heard us talk about every day, every week, and every month. The next question is how will folks be notified when they're eligible for the vaccine? This person was 70 years old and in poor health. I can tell you on a conversation with the governor this morning, he was talking in terms of the second wave after the first wave, which is frontline healthcare workers and nursing homes and assisted living homes. That next wave, phase 1B, I guess is what they would call it, will be people who are 70 and older, along with firefighters, law enforcement, people that take care of the jails. Because in reality, the vast majority of the deaths that occur, I think it was 66%, are happening in nursing homes and assisted living homes. And probably the rest of them would be in those folks who are 60 years and above. So the one thing the governor said this morning was things change rapidly. So be ready. If it's announced, be ready. Next week, I am going to try to get Clay Horton to come on again with the health department, and perhaps Clay can give us a little better idea of how folks will be notified when it's their time and how they would set up appointments and all that. But Dr. DuFrayne, do you have anything to add to that?
Yes. So first of all, I want to comment on the state. I have to tell you, I think they've done a very good job. Mm-hmm. We had our own little glitch here, which the state was very responsive to and delivered it to us in a timely fashion, and we've rolled out really seamlessly.
Let me interrupt you. That glitch is the answer to those people who were raising Cain about Owensboro Health not receiving the vaccine when the other 10 or 11 hospitals happened. That wasn't based on anything other than a glitch.
That is correct. So it really came down to a clerical error. The state and Owensboro Health worked very closely and we resolved it quickly. So it put us about 5 days behind. I think the state has done a very good job throughout the Commonwealth. And they have been very good in communicating with us as to how to start, when to start, how to start, and focus on. So right now, we focused on frontline healthcare workers, all those people who are dealing with patients every day. We've been pretty busy with them, and we've gotten a good number of them already done. And then we'll go through different tiers, just like you said. When it comes to outside of the hospital, we are going to take our lead from the governor's office and from Dr. Stack from the Kentucky Department of Public Health. And they're going to, again, put out a tiered system that says, and what I've been told before is typically 65 and above, particularly those with other medical conditions, and then 65 and above without medical conditions, then people in their 40s and 50s with medical conditions, and then those without medical conditions. So it's a thought out plan. We have a total of 19 sites throughout the counties that we serve that we've ordered vaccines for. And once the state says, okay, let's start with the second tier. We're ready to go, and we'll make those announcements along with other services throughout the community. We work very closely with Clay and we'll coordinate with Clay and how we do it, who comes in first, how we get the word out to people. I'm looking for public service announcements. If you are 65 and above and have medical conditions, you know, for the next 4 days, we're going to vaccinate at these 19 sites that are Owensboro Health, in addition to the pharmacies, the CVS, and the Walgreens, that have what the state does with them, with the health departments throughout the state. So it's coming together as a fairly well coordinated, and we're taking our lead from the state.
Right. It will take a while to get ramped up, but once we do, it will move pretty quickly. Now I'm going to date myself. I remember back during the polio seasons in the mid to late 50s, once the Salk vaccine came out, it was a while and parents were upset, but eventually they got things ramped up and they vaccinated all the kids who were affected by polio more so than another age group. But they did a pretty good job, and I expect us to do the same. You've spoken to this reaction to the shot. I know what I've read and what I've heard. Yes, you're going to have some reactions the same way you do to any vaccines. Most of the time, they're asking that you tell them if you have had reactions to other vaccines or other medicines, because it's not being a medical person, but if you have a reaction to one thing, lots of times you have reactions to several other things. So besides the soreness, have you heard of anything else in all the healthcare workers that you've had out there?
So first of all, we've had no serious side effects or complications. We had one person who was seen in a clinic because within several hours she had some symptoms, and those went away quickly. For the most part, I'm hearing, and this goes along with really what the CDC says they've found in their testing. So about 80% of people will have soreness at the injection site. It just means your muscles are a little sore. Usually goes away by the next morning. You can have other things. You can have body aches, muscle aches, joint aches. About 50% of people will have that. All the way down to some people will have a fever. About 15% of people had a low-grade fever, which again went away. They are recommending that if you can take them, take ibuprofen, which is Motrin or Advil. Take ibuprofen before your shot or Tylenol before your shot. It seems to help a number of people, but only if you can take them. And within 24 hours, most people really would tell you they were back to normal.
Right. Those reactions, a lot of times from what I've read, is really the body's reaction as they ramp up your immune system to produce the antibodies against the virus, and it goes away pretty rapidly.
And that is correct. So first of all, let's address, can you get COVID from this vaccine?
Thank you. That was my next question.
So that answer is no. Just like you can't get the flu from the flu shot. Some people will have some symptoms and then they interpret it as, oh, I got COVID, or oh, I got the flu. No, your body's just reacting and keeping you healthy. So there are chemical messengers in our body. So let's take the simple cold. So it's not the cold virus that actually gives you all the symptoms. It's our body's reaction to it. So you produce something called interferon, and the interferon says, oh, look, there's a virus here, let's get rid of it. And in getting rid of it, you get the stuffy nose and all the symptoms. So our bodies react really well to these vaccines, as they should. And those symptoms are gone, like I said, within 24 hours. And you're not going to get COVID from it. You're not going to get flu from the flu shot. You're not going to transmit it to anyone else.
Okay. Well, some of my cellular biologist friends on Facebook are spreading the false accusation that because they're using messenger RNA, that they're changing the DNA in your body, which couldn't be further from the truth. That just tells me, and as a biologist by education, that tells me these folks need to do a heck of a lot more reading, because really the messenger RNA that is put in there is in there to make a protein, part of the spike protein that is associated with the COVID-19 virus, so that your body will produce the antibody that will get rid of that or destroy it. So the messenger RNA has nothing to do with your DNA, and the DNA is what makes you who you are. So
that is correct. And you were born with that.
Yes, that's correct.
So you've given a great explanation. I'm not even sure you need me anymore, Judge. You gave a great explanation, and that's exactly how it works. So the messenger RNA is a small piece of genetic material of the virus. So think about it. Years ago, you talked about polio. We took the polio virus and eventually had to kill the virus, but inject it so your body reacted to it. Now we don't have to do that. We can get it down to a very small piece of messenger RNA, genetic material, that induces your body to create a protein. And that protein we call an antibody. And that antibody is to the spike protein. And why that's important is the antibodies that are now in your system from the vaccine will then join on to the spike protein in the virus. And that virus can't sit in the receptor, so it can't come in your body. But it can't infect your cells. And that's how it works, but it will not alter your DNA.
I always have thought about antibodies as something like it glues itself to the outer coating of that virus. And you're right, it just gums up the works. Now the virus is ineffective.
Cell has proteins on the outside of the cell.
Right.
To communicate with other cells. So this vaccine actually gums it up, as you said. So it's the surface of the virus and it can't go anywhere.
Right. I have a second question, and this is political. This is private sector. The question is, will we have the right to refuse the vaccine? And if we do, will we be penalized for refusing it? And my answer is simply, I know of the government has no intention of forcing anybody to take the vaccine. I don't think the healthcare part has any intention. As a matter of fact, if you decide not to take it, and I think that's not smart on your part, but if you decide not to take it, that just means that there will be more vaccine for the next person who wants to. Now, the penalty would come from the private sector, perhaps, or your employer, because they absolutely have the right to tell you, if you don't vaccinate, then we're not going to employ you any longer. Or if you don't vaccinate or produce proof, you're not going to fly on our plane or ride our train. So it's kind of a political and a private sector question, but I have heard of no indication. I think even at the Owensboro Health, as far as flu vaccine, your employees have the right to refuse to take the flu vaccine, if I'm not mistaken. Now, there are other things that they must do. You kind of accommodate them, but I think that's going to be the way things are here. I'll leave it up to you to add or rebut.
No, I agree with you. So this, to me, is not a political issue. Out there has said you have to take the vaccine. Federal government, state government, local governments, no one has mandated it. At our organization, we've had a number of questions from our employees, would we mandate it? And the answer is no. We strongly encourage it, like we strongly encourage the flu shot. And there are some people who don't want to get a flu shot or can't get a flu shot for whatever reason. And during the flu season, they have to wear their mask the whole time that they're in the hospital working. So, but are we going to mandate this? No. Now, you are right that in the private sector, and this is backed up by the EEOC.
Yes.
The employer can mandate that you get the vaccine or you could lose your employment. That's an individual company decision. It has nothing to do with what the government's telling us. It has nothing to do with what Owensboro Health leadership is telling their team members. We strongly encourage it. And there are a lot of reasons why people are afraid of vaccines. I was just speaking with somebody today, and I said, "You're going to get the vaccine," and their answer was, "I think I'm going to get it, but this is so new. I have all my other vaccines. I'm not afraid to get vaccines, but this is just so new. I'm a little nervous." I said, "I understand it, but you got to keep in mind, messenger RNA technique has been around for at least 30 years. So we've never had to go to use it. They have used it, I believe, in some animal diseases, but not yet in humans. But what you understand is 10, 15, 20 years from now, all your vaccines will be by messenger RNA.
My understanding is that they can, once they determine the virus, it takes a while to determine the virus and the DNA makeup. But once, or actually, I think viruses are mostly RNA, and that's how they infect your body and get your body to do the thing to make copies of them.
Correct.
Yes. So, but once they find that sequence or what is unique to that virus, then they can ramp up very quickly. And that's why they were able to produce this vaccine in months instead of years. And they actually have used, from my research, they've used messenger RNA to produce vaccines for the Zika virus, Ebola virus, and a couple others. But it allows them to scale up the production of the vaccine a lot quicker than the old way of creating viruses, which means you got to grow the virus, live virus, make sure that you don't infect lots of other people or it gets out. Then you got to kill the virus. So it takes a lot longer. But you know, I am absolutely, I've heard people that a lot of the anti-vaxxers will talk about it causes autism. And my question is simply this. So we never had vaccines against viruses for a long, long time. But I remember a very famous person whose name was Helen Keller, who was severely autistic. She never had a vaccine in her life. So autism existed before vaccines and will exist even if you don't take the vaccine. It's just a fact of life.
Absolutely. And we now have vaccines against a lot of viruses, hepatitis A and hepatitis B.
Yes.
Those are both viruses. And we vaccinate all the time. People do.
Right. Well, measles, mumps, and chickenpox, the vaccine that we had when I was growing up it ran through our family of 12 kids.
Right.
Now, you know, we were fortunate. Around the world, there are a lot of people who die because of those viruses, because of complications, and we don't see that anymore. So if I already had the COVID-19 and recovered, do I need to get vaccinated?
So the short answer is yes, for several reasons. We do know that the majority of people who are infected with COVID will develop antibodies. We're not entirely sure if those antibodies are 100% protective. We don't know how long those antibodies last. So what the recommendations are, and particularly if you receive treatment. So if you receive remdesivir, if you receive the monoclonal antibody, which we're giving out here, if you received either of those treatments can actually last in your body for up to 90 days. So we know you're more than likely protected for at least 90 days, even if you haven't gotten any of those treatments. And the treatments may interfere with your accepting having your body react to the antibody, to the vaccine. To the vaccine. So we're recommending that you wait close to 90 days after you were documented to have the infection and then to receive the vaccine. Yes, they need the vaccine.
It's just another layer of protection. That's number one. And number two, we are still just barely a year removed from the discovery of the COVID-19 virus and the announcement that it was out there. There's still a lot that we don't know about it.
Oh, I agree. So going back to what you said about the messenger RNA vaccine, so the only two vaccines we have right now are both messenger RNA. And the reason they're out so quickly is because they're really easy to make.
Yeah.
Which is what you said, you know, in the old, with other viruses, you have to identify the virus, you have to grow the virus, and you have to kill the virus, you have to make sure it's safe. That takes a couple of years, quick process. And all the other vaccines that are coming out are nowhere near ready because they're not using messenger RNA. So it is very easy to produce. We got it out so quickly. Yes, you need to get it if you've had COVID. And yes, you can still get it. CDC just produced guidelines this morning. And even if you have other conditions, if you are living with HIV, you get the vaccine. If you have other conditions, a condition called Bell's palsy, where one side of your face can be paralyzed, usually temporarily. If you had Bell's palsy, yes, get the vaccine. If you've had Guillain-Barré, for those of us old enough to remember the swine flu in the 70s, some people developed Guillain-Barré after that flu shot. And even if you've had Guillain-Barré, still get the vaccine. They've actually been shown that it's safe. So,
while we're on it, it just came to mind, takes a little bit to jog this old rusty brain of mine. Once I'm vaccinated, that means I'm home free. I don't need to wear a mask. I can go to big parties. I can do all those kind of things. Not.
So everybody here, the 1,000 people so far who have been vaccinated at our organization, still come to work with their mask every day. So you have to wear the mask. We're not through this. The general population has not been vaccinated. And I agree with you. I think it's going to be spring into early summer before we get everybody who wants to receive a vaccine, their vaccination. And we're strongly encouraging to still wear a mask. The studies recently have shown with this new variant that's coming out that the vaccine works against that. It's a mutation. It just makes it a little bit easier to spread. But other than that, it doesn't make you sicker. It doesn't make it, the mortality rate from it is not higher. It's just easier to spread. And just this morning in Colorado, we've documented our first case. And that person has not left their county. So he obviously got it from someone else who did. Wear your mask. It's as simple as that.
The funny thing about viruses, they mutate, they change, they evolve over a period of time. And while we're talking about generations in the human world of being 30 or 40 years, in a virus's world, it might be months, and you get a new generation every month. And there's an opportunity for that mutation to occur. Now, the best mutation would be for this virus to mutate in a way that it was less transmissible. But apparently what we've got in this mutation is one that makes it more transmissible.
That's absolutely correct. So first of all, we all mutate. When you develop cancer, that's because some cells in your body have mutated. Your DNA has changed. From a lot of things. It's just from the environment, it's from smoking, it's from a lot of things that will change, will affect our DNA. And a lot of times those changes mean nothing, but sometimes they can make it more infectious, more contagious, or more lethal. So the fact that it's mutating doesn't surprise us in medicine at all.
Right. We pretty much have answered this. The question is, how soon will the vaccine be available to the general public? I mean, as quickly as possible. Everybody's working as speedily as they can. It's the logistics of the thing that will take some time, but I'm hoping by the middle of the summer, anybody that wants it will be able to get it. Here's a question. Can a person choose between the Moderna and the Pfizer or the AstraZeneca, which I understand the United Kingdom has approved? Can they choose their vaccine? And I think I know the answer, but tell us.
So in an ideal world, if we had both Pfizer and Moderna and we had the new AstraZeneca one, yes, we would give you the option, but no one has that supply yet. So even here in our Commonwealth, the first vaccine to roll out was Pfizer. So the first hospitals got the Pfizer. The second load that went out is Moderna. We don't have Pfizer. We have Moderna. But yes, if we had that, we would give you the option.
The simple fact is, now I can't talk about AstraZeneca because it's not been there and I haven't seen the information, but both Pfizer and Moderna are roughly 95% effective. That's somewhere around the measles vaccine effectiveness. Flu vaccine is actually less effective than that.
Depending on the strain.
Right.
Multiple strains of flu, because what we just talked about, you do have mutations. We have several strains of flu. So depending on the strain, the flu shot is about 60 to 70% protective.
Right. So again, I think we answered this, but will I have to go to the hospital for the vaccine? And the answer is there's going to be many, many places that they can go. It will be available there at the hospital or at the clinics that make up part of the Owensboro Health system.
So we're already setting up for the clinics in Henderson and in Muhlenberg and in Madisonville. Our urgent cares throughout the region all be able to give the vaccine once the state sends out a supply. So you can't have everybody coming to one place. 100,000 people in Davis County would just overwhelm us. So we've figured out we want people to travel if they don't have to. And it's easier for us to get the vaccine out to those clinics than it is to have everybody come here.
I'm hoping perhaps and I haven't talked to Clay and I'll try to broach this with him, but I'm hoping to have some mobile vaccine units, kind of like we've done with testing, where we would go into certain areas of our community and make that available. But that's a question for Clay when he comes along. Last question that I see, well, I've got one more. So first of all, how about my insurance? Is it charged? Am I charged? Who pays for this thing?
So right now we charge no one for the vaccine. And that because it's supplied by the state. We're not going to charge you for something that the state's giving us.
Right.
There is, for our own employees, our own team members, there is a charge for administering it, just as there is for all vaccines. That goes to your insurance company. And if the insurance company pays it, great. If not, no patient, no one who receives the vaccine will see a bill.
Okay. Another question that just came in, high risk designation. Who does that include and the notification process? First of all, the high risk is determined by, I think, CDC, the federal government, the state government. We locally have a little bit of leeway, I think. I know I had a conversation with Clay yesterday about our coroner and the deputy coroners. They are dealing with folks every day. They go into homes about would they be able to get the vaccine. They said, well, let us think about it. Came back this morning. We're going to vaccine them because they're in homes just like our emergency responders. So I think that's the case. As far as notification, again, I'm going to defer until next week when I talk with the Green River Health Department. And maybe we can get Clay to give us a little more clarification, and the state may give us a little more clarification.
And that's really what we're waiting for. We're waiting for the state to notify us how to get the word out.
Right.
So, and I think that's actually a good way to do it. So,
sure.
It means through every county throughout Kentucky, everybody doing their own individual thing. No, this is a unified, this is how we're approaching it. This is how we're going to protect our citizens.
Okay.
I like the approach.
Well, Dr. DuFrayne, thank you for being with us today. I hope we were able to answer some of the questions that folks had. I hope that we were able to allay some of the fears out there of the unknown, and it's not unusual. And don't feel bad if you have a kind of a fear, because we all are dealing with really an unknown. We've been dealing with it for the last year, and there are things that could happen, might happen, but in the end for me, when my turn comes, I'm going to stand up, roll up my sleeve, and hope that the person that administers it doesn't hit the bone. Right. But I just would ask the folks out here to be careful. as we enter the new year. Again, stay away from large crowds. Make this one New Year's that you celebrate with your loved ones who are near and in your household, so that they're here and you're here next year to celebrate again, or to enjoy this summer when hopefully things will open back up. So with that, thank you again, Dr. DuFrayne. Folks, I would advise you to go on the web page, Facebook page of Owensboro Health, Green River Health Department, the Davis County Fiscal Court, because as soon as we know, I am very confident that you will know how you would sign up, how this vaccine will be distributed, because we try to keep everyone as informed as we can. That's exactly, we want you to have any knowledge that we have. We don't want all the misinformation that's floating around out on Facebook right now to continue to float around and scare somebody away from taking this vaccine or that would protect them and their loved ones. So, Dr. DuFrayne, have a happy new year.
Thank you, Judge, and you too.
Okay, and folks, for all of you, have a very happy and safe new year. Thank you.